Okay, we'll make a start. Thank you all very much for joining us today. My name's Gail Gibbons. I'm an Assistant Director of Change at the Youth Endowment Fund with responsibility for children's services, neighbourhoods and the youth sector. And I'm really delighted to invite our guest today and for you for joining us. Our topic, as you'll know, is creating the conditions for evidence use, national and local steps to mobilise. We are recording the session and we will be keeping your cameras and mics off unless we've invited you to speak or you've put your virtual hand up to speak or you've made a comment in the chat and we bring you in to talk a little bit more about it. After the event, we will be putting both the recording and all the slides that you see today up on the Youth Endowment Fund website. So you will be able to access those and hopefully signpost colleagues and associates to those as well. So our speakers today, and this is in order of presentation. First of all, we have Sonia Beard, who is a Senior Policy Advisor at Foundations. And she's going to be talking about the use of evidence nationally and locally and what national government can do to facilitate it. We've then got Louise Bazalgette, Deputy Director of a Fairer Start mission, who's based at Nesta. And Louise will be talking about this programme in her presentation on why evidence matters. And then we have Jo Flanagan, who's a Senior Practice Development Advisor at Foundations, Rob Newton, Local Evidence Lead at City of York Council, and Louise Ashwell, Senior Consultant at Cordis, who will be talking about the Changemakers programme, which is a DFE funded and YEF funded programme, but managed by Foundations. And they will be talking through the programme, both in terms of how the programme runs, but also Cordis Bright, as the evaluator, will be talking about the interim evaluation. I do encourage you to put any comments or reflections or questions in the chat as we go, and we'll then bring you in at different points. And I'll be pausing after each speaker to ask if anyone's got any questions. And also at those points, if you'd like to raise your virtual hand, we'll also bring you in at that point. So we will start with Sonia. Over to you, Sonia.
Thanks so much, Gail. As my slides load, nice to see you all this afternoon. I hope you're having a good day. I'm Sonia, as Gail said, a Senior Policy Advisor here at Foundations. I lead our work across our parenting portfolio mostly, and I'm going to talk to you a bit around the role that national government have in facilitating evidence use, both nationally and locally. Before I do that, if you're not familiar, because I know we'll be speaking about Foundations a little bit throughout this session today, just a bit about who we are. So Foundations are the National Work Centre for Children and Families. We were established in 2022. Our overall vision is to ensure that children have the foundational relationships they need to develop and thrive. And we do that through a range of ways. Mostly we generate and champion actionable evidence to provide information about what works. We influence local and national decision makers to use the evidence that we generate, as well as others' evidence, to drive improvements in support for families and children. And we want to increase the demand of evidence about what works to strengthen those family relationships, as well as highlighting those gaps that need to be filled in the evidence that we don't have. Our overall strategy and scope is for those children who require targeted support to address family level risk factors, those children experiencing harm, for example, or abuse inside the home, children who are in care, or those who are care leavers. So we do a lot of work on evidence generation, and I know that colleagues will talk about the Changemaker programme in a minute as one of the many things that we do here. But in terms of what I'm going to speak about just in this little session that I've got this afternoon, goodness, it's 2 o'clock. I'm going to talk about evidence into practice, the gap in evidence into practice and why that's important. I'm going to talk a little bit around the interface between policy, practice and evidence, and the kind of mutually reinforcing role that those three things have. And then the meat, I guess, of this discussion will be around national government and facilitating evidence use. So we know that evidence-based approaches are the most reliable way to prove outcomes, but interventions with the strongest evidence are not always routinely ones being used in practice, and there is a gap in the evidence into practice gap. Some of those commonly adopted approaches really have a limited evaluation, whilst others have really robust evidence are not necessarily widely available. And Nesta have done some great work in understanding what interventions are or aren't available locally, depending on their amount of evidence that they have. Understanding the impact of interventions isn't something we tend to do routinely, but there's lots of activity that is out there and being used locally that isn't necessarily evaluated or is only really monitored for outcomes and not necessarily considered on impact. So we know the result of something and what the result might be, but we don't know as much about what the effect it may have had on outcomes for children and families. That doesn't mean it doesn't work. It probably does work locally, but it just means we don't know what the effect it has in improving child outcomes. For us, we know it's important to support local authorities to combine that what works evidence with other what works evidence and range of evidence, which is what this evidence pie on the screen shows here. And I suspect that Rob will talk a bit about it later as well. But we want to make sure that services are equitable and built to last, and there's a role that a local and national government have to facilitate the use of all these ranges of evidence. And this evidence pie really captures the importance of different types at different times. And Rob, as I say, will touch on that shortly. Whistle stopping through, just a bit of a comment on the intersection between evidence, practice, and policy. And this is kind of at the heart of what we do here at Foundations, where policy, practice, and evidence converge. This framework really guides what we do, and our teams reflect each corner of that. So our organisational setup is between our evidence, practice, and our policy teams, really taking the evidence that we have into national policy, but also into local practice. And I want to use this structure to kind of outline how I think government has a role in facilitating evidence use. So government can do this, and I'll talk more detail shortly, but in investing in evidence generation, using that evidence one at the top, so embedding evaluation into policy delivery and policy decisions. The policy that government lead and have ownership for, they have to really hold that and lead with that, with guidance, support for local authorities, as well as enabling that join up across local authorities. And in practice and in local delivery, really creating the conditions to drive evidence use, which I will speak about, but with capacity, support and funding to enable that delivery. So I guess the meat. What can be done about all of this? Government have a really crucial role in driving scale up and driving evidence use, and to ensure that the right infrastructure is in place to support and facilitate the use of evidence in national decision making, but also in local delivery. We've known though for a long time that it's not just a matter about finding out what works and telling people. That doesn't do much or change many things. We really need government to get behind us to create the conditions nationally and locally to embed that evidence and the use of effective approaches for scale up. It is very difficult to get delivery at scale, improve outcomes at scale, the kind of caliber at which we want to and need to, without that central involvement, and government have a really crucial role in facilitating that. So the first one that I'm going to speak about is about setting the vision and the ambition, and it's government's role to drive that policy across a range of departments through other delivery chains. Other countries have really got behind this and really put their shoulders behind driving the use of proven interventions. And we started to do that here. We see it in Best Start Family Hubs with the focus on parenting, but maybe not so much in other areas. And there's a role that government have to facilitate that drive across other policy areas too. And that really requires a clear central narrative. So, as I say, using parenting as an example, narrative of parenting being intervention or a policy area which improves outcomes for a range of departments and not just one. So we want to make sure that government is getting behind that narrative and driving the story of the outcomes that we know we see in parenting to yield benefits, not just for one department, but across government, the role of parenting really being prevention. So DfE and other departments that hold the policy levers for these areas really have a role in bringing along other departments with them, DHSC, the Home Office, MOJ, to ensure we're all moving in the right direction to create the story about the role in which parenting interventions have for improving outcomes. The second one is on evaluating for impact, and government have a key role to play in supporting intervention development, as well as evaluating the promising models that we know exist and continuing to develop interventions and understanding on the interventions that we already know have what works evidence behind them. It's obvious for us as What Works Centre to say this, but it's worth reminding ourselves that we do know a lot of things that work, and that hasn't happened by accident. So we need to be really purposeful about the evaluation that we're doing on different programmes. and it's government's role to really create that evidence pipeline and the development of evaluation for interventions as they emerge, as well as supporting interventions to create the conditions to be evaluated later down the line if they're not necessarily ready to be evaluated yet. The third is creating the incentives and conditions for scale up to happen. And this involves supporting providers of effective interventions to deliver at scale so they can spread more widely. And that doesn't always have to be government, it can be other organisations, but government needs to make sure that that does happen and that scale up is kind of core component of the delivery of effective interventions. There are lots of relevant levers that we can use to ensure that we can drive scale up of proven approaches. For example, funding is an absolutely necessary and key one here, and it would be amiss if I didn't mention it. But ring fence funding is obviously likely to increase the commissioning of proven models, and there's really scope to consolidate some funding locally, which government has to get behind and facilitate in order to create the scale up happen. We know it's happening in Best Start in Life with specific interventions and menus that are supporting local delivery. And there might be, and we know that some may argue against mandating against specific models, and that on its own doesn't work. And it's about the conditions around that menu that drive evidence use. The last one, and then I will wrap up and hand over, is around supporting local commissioning and implementation. And this is strategically seamlessly placed at the end of my section to hand over to colleagues to talk about local evidence use. But local government have a role, central government, have a role in supporting local government with clear, reliable information about what interventions have been shown to be effective, as well as supporting them with guidance and facilitating the capacity, for example, through a role like a local evidence leader to enable that evidence to be translated into practice. Knowing what works is the easy bit, we would say. Making it happen and implementing locally is the hard bit, which I know we'll hear about from colleagues shortly. Lots can get in the way of delivering evidence-based interventions, the scaling, the need, resource, time and capacity, and government really need to get behind supporting local leaders to use the evidence that they already have, as well as the evidence that they should be supporting to generate to impact outcomes for children and families. So as I hand over to colleagues to talk a bit more about the local position, I just wanted to flag this, that these national inputs that I've spoken about, the local funding, capacity, nationally facilitated learning and facilitating ongoing evaluation are really those inputs that will improve outcomes in the local area. So I will stop there. There's lots to say in a short amount of time, but thank you for having me to share some thoughts on what national government can do to facilitate evidence use.
Thank you so much, Sonia. I just lost my sound then and it's just come back, which I'm really pleased about. Any questions for Sonia before we move on to Louise? I just had one actually. You mentioned right at the beginning, Sonia, that some countries are doing this really well. Are you able to share any information about which countries are doing this well? I'd be very curious to find out a bit more about that.
Yeah, of course, I can send it across afterwards. I think other countries, Scandinavia, for example, have a great role in forefronting evidence use and evidence generation in a way that maybe we haven't quite got yet. But there's lots of proven interventions that have improved outcomes. And the US has a great kind of evidence model that they embed evaluation lots very locally and quickly. A lot of the evidence that we use here at Foundations and our practice guide does come from a US background because the evidence base is quite strong there and they really invest in evidence generation. So yeah, I can follow up with colleagues as well offside the call. I can share with you, Gail. But those are the two that come to mind, the US and Scandinavia.
Thank you. Any other questions before we move on to Louise? No? Okay, come on. We'll if you can close your slides, Sonia, and then we can bring Louise in. We're nearly there, I think.
I think it's just loading. Apologies for the delay. Has it
it's
appeared on screen?
It's come on the screen, but we've started with a slide that says what next.
Yeah,
so,
sorry.
Yeah.
Some taking itself to the end of the presentation, helpfully.
Yeah.
There we go. Okay, I think we're on the right slide now. Yeah. Hello everyone. I'm Louise Bazalgette from Nesta. And I'll just briefly introduce Nesta before continuing the presentation. So for anyone not familiar with Nesta, we're a charity and an innovation agency for social good. We design, test and scale solutions to society's biggest problems with the aim of changing millions of lives for the better. And while Nesta has been around for over 20 years, we've had our early years mission, A Fairer Start, since 2020. And just to tell you a little bit more about A Fairer Start, this is our mission that from the year 2030, every child will have the same chance of developing to their full potential in the early years. As we know, babies and young children growing up in poverty are less likely to have long, fulfilling and happy lives than their peers. And the early years up to age 5 are when the foundations of physical, emotional and social development are laid. But babies and children are growing up in poverty are more likely to miss out on the resources and experiences needed for healthy development. Our mission aims to level the playing field and ensure that more children from low-income backgrounds reach their early developmental milestones. And also, notably, our mission aligns very closely with the UK government's Opportunity Mission, which I know everyone here will be very familiar with, which aims to ensure that 75% of 5-year-olds in England will reach a good level of development by 2028. And this will require between 40 and 45,000 more children every year reaching a good level of development by the end of their reception year in school. And then just to emphasise that this is an equity issue, this slide shows why it's also important to consider the distribution of children receiving a good level of development across income groups. So in Nesta's Fairer Start mission, we're particularly focusing on children from lower income families because currently, as we can see here on this slide, they're much less likely to reach all of their early learning goals compared with their peers. And then in this presentation, I've been asked to talk particularly about the implementation problem and specifically why evidence matters in times of huge service demand and also what are the barriers to evidence use. So to start with, firstly, why does evidence matter? Well, as Sonia covered in her previous presentation, we know that parenting interventions are a highly effective tool for improving child development outcomes. However, there is a huge amount of variation in the market of parenting support. And we recently carried out a project at Nesta called Parenting Support at Scale Market Analysis, which looked at 135 different parenting programs, those which target either children's socio-emotional or cognitive development, and programs that are for parents of children aged under 5. And we found that, as we well know, these programs do not all have evidence of efficacy. They're actually at a range of different stages in terms of developing their evidence base. And this really matters when you have a measurable national target about trying to improve children's development. At Nesta, we're very clear that to achieve an impact on a measurable target, we do need programs that have a proven track record of driving a positive impact on children's development. And so a lot of our work has been about looking at how can we both identify those programs and scale them, but also how can we continue to develop that evidence base and support more programs to develop their evidence. So looking at the next slide, this shows a graph from our recent report, Parenting Support at Scale Market Analysis. And it shows there are a lot more programs targeting children's socio-emotional development that can currently be classed as evidence-based compared with other types of outcome. If we class them as evidence-based in line with how foundations define that, it means that there is robust evidence of previous impact on child development. And when we look at children's socio-emotional development, there are 28 programs in that category, which is the blue bar on the graph to the left. But comparatively, there are only 8 programs targeting children's communication and language that can currently be classed as evidence-based. And overall, we found that there are fewer programs that target children's cognitive development, which are already evidence-based. We also identified there are ongoing challenges with scaling evidence-based programs because interventions that are evidence-based are not always feasible to implement at a large scale due to considerations of cost and other aspects of implementation. So looking at our next slide, so this consideration of what programs can be implemented at scale does matter because to meet the government's targets and to meet Nesta's own mission goals, we will need programs that can be delivered to a very large number of families and improve outcomes for a large number of children. And in our report, Parenting Support at Scale Market Analysis, we estimated that if effective parenting programs were rolled out to all families with children who were experiencing the highest 20% of behavioural difficulties, this could mean that approximately 8,000 more children in England would reach a good level of development every year. That's if those programs are delivered at a high quality. But to achieve this outcome, we would actually need to reach 120,000 children with identified needs each year with effective programmes, because not all children who receive programmes will experience enough benefit or improvement to reach good level of development, and some of those who reach that target would have done anyway. So you actually have to reach a much larger number of children in order to actually see that impact on a good level of development at a large scale. So we also looked at which programmes are currently being implemented in our recent work. In our report, Parenting Support at Scale, we looked at data on what programmes are being delivered via the previous Family Hubs programme. And what we found was that evidence-based interventions are generally not being implemented more often than those without proven evidence. We found that looking at the data for Family Hubs in England and also looking at other mechanisms for delivering parenting programmes in the UK, we found that what's being delivered actually seems to be driven more by other factors. So programmes that are being implemented more widely seem to include those that can be more easily tailored to families' individual needs, and also those that have a group delivery model. And these trends may be related to, in local areas, their understanding of parents' preferences and delivery needs and wanting to tailor their delivery to those needs. It may also be due to the considerations of cost around programmes. It may also be about evidence gaps and not necessarily being able to find the right evidence-based programme for the particular population that local authorities are aiming to support. And then also we think it's probably a factor that there are challenges navigating a complex market of different programmes, and also variations in perspective about what level of evidence is enough. And so there are a range of different factors that might be affecting the uptake of evidence-based programmes and what's being implemented. So on this slide, you can see we'd sort of attempted to map out really what are some of the current barriers to evidence use, and how might that be affecting the market of parenting programmes. So starting at the top, the sort of purple semicircle represents those who develop interventions. And those who develop parenting interventions are generally trying to develop the evidence base for their programmes. However, it's expensive, as many of us know, to create robust evidence for new programmes via evaluations such as randomised controlled trials. So the cost of evaluation can be a first barrier to developing the evidence for a programme. And then moving on to the sort of second point on this diagram, even once evidence has been created, it can be of varying quality, so it really needs to be assessed via a what works centre such as Foundations, which carry out this role in their guidebook to really understand which evidence is sort of sufficiently robust for us to consider that as kind of trustworthy information about the impact of a programme. And then next, even when there is good evidence available, the features of different parenting interventions are complex and diverse, so it's challenging for commissioners, represented in the middle by the orange semicircle. It's challenging for commissioners to navigate all of the options available to them and assess which of these programmes are most suitable, as we're often navigating quite a large number of programmes. And then those who commission parenting programmes often also don't have access to good data about the profile of families in their area to inform their commissioning decisions. And we think to have really good feedback loops, you would also need to know about families' need for interventions, feedback from families themselves about what support they want, and also data about take-up to really understand if implementation is working. And again, that can be a barrier because a lot of that information isn't necessarily easily available or being gathered. And then a very important point, number 5, is that commissioners are limited in what they can commission according to the budgets available to them. They're working within the funds available. And then finally, to keep iterating and improving parenting interventions, those who actually deliver and develop those programmes would ideally get data directly from families, which they could then use to inform the further development of their programme. But these kind of direct feedback mechanisms between the families themselves and those who develop programmes aren't necessarily in place, depending on how that programme is being delivered. So altogether, these barriers in the market can prevent the effective generation of evidence, informed decision-making about which programmes might meet families' needs best in a local area, and also the continuous improvement of programmes. And so in terms of what's next, there are many different organisations working in this space to try and improve this picture, and Nesta is one of them. So some of our recent activities in this space have been aimed at tackling some of these challenges in the market and overcoming some of these barriers. Firstly, we've been doing policy work aiming to help clarify which programmes currently have the strongest evidence and promote a shared commitment to delivering programmes that are most likely to drive improved outcomes for children to give us the best chance of meeting those national goals around more children reaching a good level of development. And then secondly, we're also aiming to make it easier for commissioners to navigate the existing evidence space and make decisions about which parenting programmes are the best fit and could be most impactful in their area. We've got great existing tools like Foundations Guidebook, and Nesta's built on this as well recently. We've been developing a tool called Pascal, which is now live, and there's a link on the slide. And I will actually just post it in the chat as well, so that people have easy access to this. This was launched just last week, and so we can use Pascal as a commissioning assistant tool for local areas, which is a free decision-making assistant which can provide tailored recommendations about which programmes might be most impactful for families living in each local authority, and then they can put in their available budget and the recommendations that are provided in Pascal about which programmes might be most impactful are kind of tailored to those budgetary requirements, and then local authorities can also input other kind of preferences in terms of which programmes they're looking for. And then the tool also has access to data about child and family need in each area, which it can then kind of bring to bear in terms of making some of those recommendations. And then we're also doing ongoing work, which we're developing with the aim of helping shape a market of impactful parenting programmes that meets the need of children and families, that parents want to access, and that are also affordable and feasible to implement, and which can be delivered at sufficient scale to drive an ambitious level of impact. We recognise that to get there, we're going to need more investment in research, development and implementation, because we're very much not there yet, although many of us are working hard on this. And this is a gap that we're aiming to address by improving funding opportunities to help with developing, testing and scaling impactful parenting programmes. So looking forward to working with many of you on an ongoing basis in this space. So thank you. That's the end of my presentation.
Thank you, Louise. That was so interesting. I don't know if I missed it at the beginning, but did you say the 135 parenting programmes you identified was specifically for early years or all age?
That's right. Yeah, that was for families with children aged 5 and under.
Yeah.
So it's a large number, isn't it?
Yeah, I know, it's quite shocking actually. I thought, did I hear that right? Or was that the whole age range? But no. Yeah. Any questions from anyone? Just if you have, just put your hand up or put something in your virtual hand and or put something in the chat. Everyone's been very quiet today. There will be chance to ask questions at the end as well if you're still having to think about it. So whilst you're having to think about it, we'll now move over to Jo Flanagan from Foundations, who will be talking about the Changemakers programme. And then Jo, if you can then pass on to Rob Newton, and then after that, Louise, so that we have a sort of smooth flow about what we've learned from Changemakers. Over to you.
Thank you, Gail. So now we're going to build on the themes that have been raised in the previous two presentations, and I'm going to share with you a programme called Changemakers, which Foundations has been co-delivering with 4 partner local authorities and 3 intervention providers over the last 18 months. So I'm Jo Flanagan, and I'm a Senior Practice Development Advisor at Foundations, and I'm Project Lead for the Changemakers programme. So I'll just give you a brief introduction to Changemakers, what it is, who our partner local authorities are. The Changemakers programme is joint funded by DFE and the Youth Endowment Foundation, and it's part of the National Family Hubs programme. It was initiated in April 2024 and ends in March 2026. We decided to create the programme because as a team, we knew that there was a gap between evaluated what works evidence and how it's taken up and used locally. And from our mini evidence review, we knew that there were common features that make local evidence use more successful. So one of the features was the role of local evidence leadership. So we wanted to explore the role of a local evidence leader as a central mechanism for implementing evidence to address some of the barriers we knew existed. So we developed the idea of a local evidence leader or LEL role, which could be used to drive effective implementation and enhance family access to support. and work as a strategic catalyst for change within local authorities and with local area partners. So the Changemakers local evidence leaders would champion and facilitate the use of foundations funded evidence-based parenting interventions which had been selected from our guidebook. And equally important, they would also support development of wider evidence literacy in strategic decision making in each host council. So the interventions selected for implementation were family foundations. So this is a perinatal group-based program for couples expecting their first child, aimed at improving children's outcomes by improving interparental relationships. Then Triple P Resilience, a support program for children bullied by their peers. And finally, Empowering Parents, Empowering Communities, or EPEC. This is a parenting intervention for disadvantaged families with concerns about their child's behaviour, aimed at children aged 2 to 11 years. So we developed a job description and person specification based on implementation theory principles, and we then looked at those principles and the key knowledge and skills we knew would be needed for the local evidence lead roles. So the local authorities then went on to use the job description and person specification for job evaluation and then recruiting their LELs. Foundations developed a delivery plan to set out the steps to follow for implementing the evidence-based interventions. The delivery plans were based on theoretical models which describe the implementation process, and the local authorities also added their own bespoke ideas into the delivery plans to ensure that implementation was feasible from the local context point of view. Foundations practice development advisors meet regularly with the local evidence leads to support programme delivery and also to discuss barriers and enablers to implementation as they emerge. They've also worked with the intervention providers to understand barriers and enablers to implementation from their perspective as well. And then Cordis Bright were appointed to evaluate the programme using an implementation and process evaluation, and they've supported us to develop a whole programme theory of change. They'll talk to us shortly about this in a little bit more detail, but I'll briefly show you the theory of change on the next slide. So the Changemakers evaluation is testing the programme theory of change, and it looks at how the dedicated local evidence leadership can embed and sustain the use of evidence. And at the same time, each of the 4 local authorities also developed their own local theories of change to articulate how they would embed the evidence-based interventions, as well as how they would enact wider system use of evidence in strategic decision making. So the process of developing the theory of change provided a space to share early thinking, planning, and an opportunity to agree local short, medium, and long-term outcomes with senior colleagues in their local authority. So I'm going to hand over to Rob Newton now. Rob is local evidence lead in the City of York Council, who will talk to you about some of the enablers and barriers to creating the conditions for evidence use at the local level.
Thanks, Jo. Hopefully you can see my screen now.
Yes, we can. Thanks,
Good
Rob.
stuff. Thank you. Thanks for the setup, Jo, and for the introduction, Gail, and the invitation to speak at this afternoon's event. It's really great to be here with everyone. My name is Rob Newton. I'm the local evidence lead at City of York Council, which is the specific named role within the Changemakers programme that Jo's just been describing to you. And I can't remember if I volunteered or I was volunteered to do this slot on behalf of all the local evidence leaders, or LELs, as you might hear me call them, from across the 4 areas. But there's at least 3 of them in the audience also this afternoon who may chip in with responses to questions if people have got them, but just give them a bit of a shout out at the beginning. So there's Maura Appleby and Louise Burns from Stockport, Adam Warner from Merton, and Keith Billington from the Wirral. And what I've been asked to talk to you a little bit about this afternoon is how Changemakers local authorities can organise themselves to make greater use of evidence. And I think it's worth starting with some of the rationale for why the local authorities were interested in being part of the programme in the first place. We've had a bit of a chat about this amongst the four of us. And I should say also, forgive the non-branded slides here, but I'm kind of channeling four different areas thoughts into one presentation. Hence the lack of branding on this. So to just say a little bit about our kind of our interest in the programme and what motivated us to get involved. My own professional background is in education, and I still work part of my time in the research practice space in schools. And I regularly reflect on a quote from a guy called Dylan William, who's Emeritus Professor of Education at UCL, who said, "Every teacher needs to improve, not because they're not good enough, but because they can be even better." Now, obviously that language places that in the education context, but this is how I feel about public services more broadly, that we have a huge amount of strengths, but we should also be continually looking at how we can improve further. I think the appeal of changemakers was emphasising a deliberate evidence-based approach, meaning that we can do that in a more systematic manner. So across all of our local authorities, there was a recognition and a desire to think about improvement work in a more systematically evidence-informed way. I think another appeal of the programme has been the opportunity to explore some of the issues around what works evidence that people have started to touch on already this afternoon, and its local applicability. Many of us came to the Changemakers programme recognising that we've experienced a difference between what works evidence tells us and the replication of those results on a local level. But what do we mean by being evidence-based? I think we've heard this afternoon already people talking about evidence-based programmes or evidence-based interventions, and often what's meant by that phrase is interventions that are being tested using specific, usually experimental design methodology to try and establish what works in the context it's being tested in. One of the major milestones we've achieved through the Changemakers programme in York is to agree upon a specific definition of evidence use within children's services, and ultimately it's complex. And so here's the evidence pie again, as Sonia used earlier in her talk, shown on this slide. And I think it's an excellent way of expressing the broad range of evidence that's useful for local areas to be considering in decision making. Our definition of evidence use includes and values all types of evidence, with effective decision making being when we attend to all sources available to us. I think it can be helpful to reflect upon this model and consider whether there are some types of evidence that we attend to more than others. One of the 6 segments of the pie includes what works evidence, which some would argue is not currently used enough in local decision making. The key for me of this framework is thinking about evidence use in balance. I'm an absolute supporter of the value of what works evidence, as I also am of using the lived experiences of communities and practitioner insights, for example. But if we view any one source of evidence in isolation or as more important, then we risk and undermine the effectiveness of our decision making. Local areas must recognise, value and understand the relative strengths and limitations of all the types of evidence included in this evidence pie. However, our definition of evidence use doesn't stop there. It also recognises that there is significant research evidence around implementation science, and through the Changemakers programme, we've collaborated to adopt and adapt a framework for evidence use based on work done for schools by the Education Endowment Foundation. The implementation science in that guidance is also what works evidence that takes a common elements approach to understanding where successful improvement work happens and where outcomes improve. What are the conditions, the behaviours and the processes that facilitate that success? That evidence is just as vital to improving outcomes for children and families. We can have the most complete evidence pie picture ever, but without very clear ways to use and mobilise this effectively, we're much less likely to make progress. So when we're talking about evidence use, we mean the breadth of evidence that exists to support decision making, as well as the evidence around how to enable change, the what and the how. The reason why I think it's worth labouring this point is that I find people frequently bring preconceptions to the term evidence use or evidence-based, and often these are centred around particular types of evidence depending upon their perspective. If local areas really want to take a systematic approach to evidence use, then I think it's helpful to surface and be explicit about the complexity and range of evidence that exists, is useful and needs to be used. Ultimately, as local areas, we need to be discerning users of evidence. Across the 4 local areas, a number of consistent themes have emerged about what actually enables evidence to take root in everyday practice. One of the strongest enablers has been access to pragmatic, practitioner-friendly evidence resources. Tools such as national evidence toolkits and online guidebooks have boosted confidence among local evidence lead and frontline leaders. In several areas, leads have used these resources to interrogate the claims made by intervention providers, to ask more probing questions about the strength of the evidence base, and to support more informed commissioning decisions. And that shift from passive acceptance to active challenge is a significant cultural gain. Dedicated capacity has also mattered. Where a local evidence lead has had time and organisational space to focus on evidence, our influence has been much greater. Each of the areas has positioned their LALs differently to suit their local context, but across the board, the message is really clear. Without ring-fenced capacity, evidence mobilisation competes with the relentless pressure of day-to-day operational demands. Even where the formal role won't be sustained beyond changemakers, there is a strong recognition that protected time for evidence planning and support is essential. Alongside capacity, credibility has also been a crucial asset. All the LALs brought deep practice experience, and that practical grounding significantly increased their influence with managers, commissioners and practitioners. In several places, this translated into a wider inquiring mindset taking hold, evident in commissioning conversations, quality assurance processes and performance discussions. Some areas highlighted that evidence mobilisation worked best when paired with an independent stance. The LAL being slightly separate from existing structures helped them ask challenging questions, test assumptions and introduce new ways of thinking. Others emphasised how the work helped them reflect on their organisational positionality and take a more deliberate test and learn approach to engaging underserved communities, for example. And within the specific interventions, there's been real value in investing in peer-led programmes and in the development of peer group leaders, with local areas reporting significant personal growth and a clearer sense of the art of the possible. But there have also been some important barriers, and they're instructive. A major challenge has been the gap between our high-level aspirations and what can realistically be achieved within the limits of existing systems. Many of the changemakers areas began with really ambitious theories of change, often orientated around structural issues such as health inequalities. While the ambition was welcome, local teams found that these broad outcomes were difficult to influence directly. A key learning has been the need to focus on simpler, specific outcomes where change is both feasible and measurable. Cultural change within children's services remains extremely difficult. The complexity of the system, combined with ongoing pressures on workforce and demand, makes it hard to embed new behaviours or sustained and evidence-informed culture over time. Then even where evidence-based interventions are selected from reputable sources, the reality of delivery does not always match the expectation. Some intervention providers have presented an aspirational vision that's been difficult to realise in practice. Others lack digital options or were less adaptable than hoped. Several areas reported that interventions listed as effective in national guidance did not land well with local families or did not work as intended on the ground. For example, interventions that had only previously existed under developer-led conditions in a completely different context were, perhaps unsurprisingly, challenging to land well. And in some cases, even the content of the intervention, itself designed some time ago, did not actually align with the most up-to-date and best available evidence. Engaging underserved communities remains a significant barrier. Areas know what they want to achieve, and many have made thoughtful attempts to build culturally responsive approaches. But in practice, families facing financial or other hardships are more likely to engage with relational, flexible support than with manualised, intensive programmes. The question some areas are now asking is whether these families actually want or have the capacity for highly structured, evidence-based interventions, and what that means for the design of support. A related challenge is equity of outcomes. Despite considerable effort, areas are not consistently seeing stronger outcomes for the most deprived families. There is a growing sense that perhaps dosage, depth and duration of support matter more than we perhaps sometimes acknowledge, and that lighter touch models may not be sufficient to shift outcomes in communities with higher needs. Finally, practical barriers exist. Limited funding envelopes being expected to deliver large-scale change, ongoing uncertainty about which outcomes to measure and why, and licensing costs that can make even well-evidenced based interventions hard to sustain. Part of the challenge of evidence use in a local area is there is a frequent underlying narrative that exists that local areas are somehow not making evidence-based decisions, or we know what works, they just need to do it. That view is problematic, and the Learning from the Changemakers sites provides evidence of that. I've never met, nor am I likely to meet, a local authority leader who is making decisions that are not based in evidence. The range and complexity of evidence that needs to be considered in high-quality local decision-making is huge. We can and should support local leaders in their efforts to use a full range of evidence in their decision-making. And, as I said at the beginning, there's always room for improvement. Taking this approach encourages us to be more discerning consumers of evidence. But let's also challenge the narrative that assumes that this is somehow easy, straightforward, or limited to specific types of evidence. If we can move towards a greater consensus around evidence use, this would significantly help local areas. Local areas benefit hugely when those around them share the recognition of the intricacies of evidence-based decision-making. We need to collectively attend to improving the quality of evaluation at local level. That means manualised programmes providing high-quality tools, resources and guidance on how to continually evaluate a programme at local level, not just relying on having worked somewhere else at another time. But it also means a shift in culture at local level, seeking to understand and learn through dispassionate evaluation, not prove or justify our choices, a behaviour that can be reinforced by other pressures. And this also means supporting the development of skills, knowledge and expertise in evaluation within local areas. Finally, we need to think more carefully about implementation evidence. Local systems are complex, and it's not just as simple as layering on something new. Implementation science tells us that there are key behaviours, contextual factors and processes that must be attended to in order for development work to be effective. I think what the Changemakers programme has shown us is that evidence use is not a distant ideal or something reserved for perfect conditions. It's something that local areas can do, are doing and can continue to build on with real confidence. Across the 4 sites, we've seen what happens when people have protected time to think well, when practitioner expertise is recognised as evidence in its own right, and when leaders and teams approach improvement with curiosity and humility. These are the things that create genuine momentum. And that momentum matters because it gives us a glimpse of what's possible. If we imagine local public services where decisions are made using the full richness of evidence available, from community insight to practitioner judgment to research and data, if we imagine interventions that are not simply just imported from elsewhere, but are adapted thoughtfully to local realities, continually refined through honest evaluation, and we imagine teams who feel confident about asking difficult questions, testing assumptions, and learning openly from what works and what doesn't. Changemakers, for me, has shown that this is not an unrealistic vision. When local leaders are supported and trusted, and when they're given the conditions to think systematically about evidence and implementation, an evidence-informed culture stops being an initiative, it becomes part of the organisational DNA. We've also seen the early signs. More probing commissioning conversations, stronger challenge, deeper reflection, and a growing sense that improvement is something that we build, not something that we buy. Of course, none of this makes the work easy. Local systems are complex, pressures are constant, and progress is rarely linear. But what gives me real optimism is that everything we need to keep moving forward already sits within our local areas. The expertise of our practitioners, the commitment of our leaders, and the willingness, shown through the Changemakers programme, to learn, adapt, and improve. If we want to continue to champion a shared understanding of evidence use, we should invest in genuine local evaluation and treat implementation as a central part of the work rather than an afterthought. Then we can create the kind of public services that children and families generally feel the benefit of. Services that perhaps do fewer things, but do them exceptionally well. Services that are thoughtful, responsive, and rooted in the realities of the communities they exist to support. Ultimately, this is why this work matters so much. Every step we take towards better evidence use, however small, is a step towards fairer, more effective support for children and families. And the Learning from Changemakers shows that these steps are not only possible, but already happening. Evidence use in local areas is not a destination, it's a continuous journey, and the task is to continue this learning forward, to keep nurturing the conditions that allow evidence to thrive, and to keep sharing insights generously, and to keep believing that thoughtful, well-implemented, evidence-informed practice is not just desirable, it's highly achievable. And if we can sustain that collective commitment, then the future of local evidence use is not just promising, it's genuinely exciting. Thank you.
Thank you so much for that, Rob. I know I've got a load of questions, but I think what we're going to do first is move on straight to Louise, who will be talking through the interim evaluation report, and then we'll save questions that anyone might have until the end. So over to you, Louise.
Thank you ever so much. Would you like me to share my slides?
Yes, please.
Perfect. And have a thumbs up or confirmation that those are sharing.
They are there. There's no text on it. It might just be sort of loading up.
Okay.
Just oh, yeah, have another go.
Thank you very much for your patience.
It's always the
afternoon.
simplest solutions.
Let's see. How's that?
Yeah, that's great. Thanks,
Better this
Louise.
time?
Yeah.
Lovely. Okay. So, well, thank you very much for having me. So my name's Louise Ashwell. I'm here from Cordis today. I'm delighted to be here. I'm just going to move my windows around. This is the problem of presenting on a laptop. I'm here today to talk about our findings from the interim phase of the Changemakers evaluation. Thank you to all of the other speakers for some really fantastic reflections already. Just a really brief overview of what we do at Cordis. We are a research and evaluation agency. We work across diverse areas of the public sector, across work with children and families, across public health, domestic abuse, criminal justice, and many other areas. And our work spans research and evidence synthesis, evaluations with quasi-experimental designs and randomized control trials, but also audits, investigations, and strategic consultancy work. So I'm going to be speaking to, there's going to be 3 parts to my presentation today. Part 1 will be an overview of the evaluation that we've been conducting. I'll be speaking to the aims, the purpose, and I'll speak briefly to the evaluation methods. Part 2, I'll be sharing our interim evaluation findings for each of the 4 evaluation questions we've been aiming to answer. And I'll finish with sharing some emerging recommendations and talk about what's coming next for the final phase of our evaluation. So you've already heard about the need for the Changemakers programme and the gap that it was commissioned to fill. So from an evaluation perspective, there's currently limited evidence out there on the systematic introduction of roles like the LEL, the local evidence lead, and how to overcome the implementation barriers that exist within and across complex local systems. So as has already been outlined, at Cordis, we're conducting an implementation and process evaluation, or an IPE, of the Changemakers programme. So that means our focus isn't on outcomes, it's really on understanding what happened over the course of the programme and how, and to a certain extent why. We're doing this by collecting data on the following 4 areas. So first of all, what did fidelity to the Changemakers model that was envisioned in theory, what did it look like during the programme? Basically, how is the LEL role operationalised in practice? And Rob has thoughtfully shared some reflections on that already. I'll be adding to some of that thinking. how changemakers has been implemented. So how implementation can kind of support or constrain the sort of mechanisms of change that underpin the program. So we'll be talking about factors like relationship building, reflective learning, kind of engaging with leaders within systems, as well as adaptations that might occur in response to the local context within which EBIs have been implemented. We'll be speaking to how the program differs across local areas. Again, kind of the contextual factors also within each local area that might drive or hinder success of implementation of both EBI implementation and kind of broader advocacy or evidence within systems. And then finally, whether there's kind of evidence of promise, I suppose. What's some of the emerging impact on having an LEL and this kind of Changemakers program more broadly on embedding evidence-informed decision-making within local areas. I'll speak to next steps at the very end, but just to say that the final phase of the evaluation will be kind of exploring the sustainability of changemakers also. So the purpose of our interim evaluation, I'll be sharing specifically the interim evaluation findings today. So the focus of the interim evaluation was on the first phase of the evaluation, which ran from March through to November 2025. I've spoken already to kind of what our evidence so far covers, so I won't go into that again. We have not kind of teased out key questions around kind of some of the processes around adopting the adopting EBIs, or really kind of the acceptability of EBIs within local areas and how they were viewed sort of by wider stakeholders. And as I mentioned, factors around kind of cost and sustainability that will be explored more in the final report. So I'm not going to be speaking to that today. And just a really brief overview of how we've approached the interim evaluation, the evaluation team at Cordis. First off, the development of a program level theory of change. We supported foundations and participating local areas to refine their local theory of change models, and together we developed a program level theory of change. That process was delivered through kind of a series of facilitated workshops, discussions, and that kind of set in writing, I suppose, clarified some anticipated inputs, some mechanisms, some outcomes for the LEL role and the selected EBIs. And I am going to be seeing the theory of change already, and I'm going to be presenting about it shortly. And that activity, that work going into developing the theory of change at a program level, and we hope for local areas developing their own local theories of change. Certainly for the program level, we think it provided some useful context to understanding the implementation, and it was helpful from our perspective to kind of inform the design of our research tools and has been helpful for our analysis. Our data collection during the intermittent phase was primarily workshops conducted with local teams, LELs and strategic leads working with each LEL in each local area. The EBI providers themselves, so those organisations which developed the EBIs which were spoken about at the beginning, and then foundations practice development advisors, or PDAs, who've been supporting the LELs thus far. And then finally, we have been kind of systematically reviewing the quarterly returns, the monitoring returns submitted by local areas. That's also included kind of for many of the local areas, kind of reviewing some of the progress notes from meetings, monthly meetings between each LEL and their allocated practice development advisor. And those notes have provided some really useful data on kind of implementation milestones, maybe some challenges that the LELs encountered kind of month to month, adaptations, how they responded to those challenges. It's been a kind of good log of month to month how things were going for them. So that kind of concludes the overview of the programme, and the next step really is to take you through our interim evaluation findings for each of the 4 evaluation questions we've been aiming to answer, which takes me to my next slide, and our theory of change. The first evaluation question concerned the programme theory and to what extent the theory of change has been playing out in practice. So the obvious place to start is to share this programme level theory of change we developed in collaboration with foundations and in consultation with the LELs and strategic leads. There is quite a lot in this theory of change, and I'm not going to go through it all in this presentation. Not least because I suspect this is far from the first time that those of you on this call are seeing a theory of change. I'm just going to walk you through some key components. So starting from the left, setup and resources, a couple of things to pull out. Obviously funds and governance from foundations perspective. There's a component here around the selection of the EBI options by foundations, and then the local authorities choosing which EBI they wanted to implement. Then in each local area, recruitment of teams, and obviously the involvement of the EBI providers who developed the interventions in the first place. Three kind of key, I suppose, buckets of providers, of participants, sorry. Those delivering the programme, local authority, and also in some local areas, VCFSE, practitioners, system leaders. Again, those are people with different sort of roles, different titles within each local area. A lot of diversity there. And then, of course, there's the families and children receiving each EBI in each local area. The activities, these are diverse, but we try to kind of anticipate in this theory of change the broad buckets of work, of types of activity that the ELs would be engaged in. I'm actually going to start from the bottom and work our way up. So delivery of the EBI, building networks and relationships, something there around creating referral pathways. Rob spoke really helpfully to this, but it's something I'll return to in his presentation, kind of iterative feedback and learning. So that in some cases is kind of through monitoring the delivery of the programme and kind of the outputs, I suppose, but also kind of creating reflective spaces for the practitioners delivering the programme. Ongoing work with the provider as well for adaptations to the intervention. And then finally, at the very top, work specifically around championing evidence-based practice, both the EBIs themselves and evidence use more broadly, creating a culture of evidence use within local authorities. The influences, or I suppose mechanisms, which inform the LEL success. I'm just going to pull out a couple here. So there's something here about LEL skills, professional backgrounds, their pre-existing relationships. We found these to be quite central and again, look different in each local area. Their awareness of research, consumption of research, consumers of research, as Rob spoke to, and something there about an EDIE lens. I'll come back to this later on. And then finally, obviously, those last three columns relate to outcomes. I'm only going to speak to the short-term ones for now. The ones in blue relate to fidelity of the EBI implementation to the original EDI model, at the same time as kind of adaptation to local context. And then there's some crucial outcomes around improved partnership working, information sharing, awareness of the EBI, and kind of use of evidence in EBIs more broadly, both from a commissioning and an implementation perspective within local areas. So a very whistle-stop view of the programme level theory of change that we developed, and some brief reflections on the programme theory. Broadly, we found that this theory of change kind of mostly captured the key programme elements as I've set out. Three key areas, I suppose, where we found that the theory maybe diverged, and where if there was a future iteration of change makers or a version of it within one local area or across several, where the theory could helpfully be refined to better reflect what was actually happening in practice. First of all, I think there's something about foundation's role and the role of a funder, a commissioner of a programme like this, extending beyond funding and oversight. We found that actually the practice development advisors, their role was maybe under the theory of change maybe doesn't do justice to the extent of the support provided. There's very hands-on implementation support, advising, They kind of act as critical friends who share resources and connect LELs with evidence. And providers also played maybe a more active enabling role than that theory of change kind of quite prevents. We would say, I suppose, this implementation support is a really key input, enabling kind of local delivery. And similarly, yeah, as I mentioned, the EBI providers are acknowledged in the theory of change, but their level of involvement in setup, especially around resources, training resources, delivery resources, governance, kind of assuring fidelity, that's quite a substantial component, which is really important to acknowledge. The second point is I put there around mechanisms. What I mean by that is that LELs have kind of worked really closely with providers to adapt EBIs to local contexts. And we would say that that's actually a major implementation activity, which in the program level theory of change we developed. Future theories would need to account perhaps a little more for the time needed for that, and that being quite a central part of this process. We had LELs that kind of dedicated time and capacity for reflection, for coordination, were really key drivers of progress. And then finally, there's something here about, I think, outcomes. We, in the theory of change, which I've just shown you, we saw that there's something there around the EBI being delivered with fidelity to the original model, but also the EBIs being tailored to the local context. Those aren't opposing things, but that there's some consideration needed, I think, about the reality and the nuances of the balance between the two and how LELs can be best supported around that quite delicate balance. So I'm going to speak to the second evaluation question, which looks at how Changemakers has been implemented to date. So looking at adoption of the programme, we found that the LEL role has been really central to implementation success. On the left, I've got some reflections here about EBI implementation. So a whole bunch of activities that they were involved in around delivery. So that included identifying eligible families, designing referral pathways, recruiting EBI delivery practitioners, identifying what those practitioners' training needs might be, what their supervision needs might be. I mentioned kind of creating reflective spaces in one local area. There was a sort of community of practice, a more formalized reflective space for those practitioners. And finally, also embedding parent voice. That looked different across local areas, but in one area that meant establishing a parenting steering group. In another area, parents were actually involved in co-delivering the EBI. And then in that kind of second column on the second half on the right, there's something there about the kind of broader work that the LEL has engaged in around promoting local evidence use. Rob, you spoke earlier to kind of the protected capacity of the LEL role. And there's definitely something, I think, around time and organisational space to undertake these kind of additional activities beyond just delivery of the EBI. So a couple of things I draw out. One is around relationship building to secure buy-in. So that can sometimes, we saw that sometimes took place through kind of really formal partnership structures, but also quite informal collaboration, maybe through kind of existing local networks. LELs have spent really valuable time promoting the EBIs, making sure that knowledge of these EBIs is spread across the system. Usually that takes place through going to sort of multi-agency forums, local strategic boards, and presenting about the EBIs there. Third, the spaces for learning which those LELs have set up with practitioners, as well as consulting EBI providers, and also many of them are involved in kind of evaluating their own EBIs. Ultimately, I think coming at this programme with a really reflective, flexible approach. And then finally, acting as advocates for evidence-informed decision-making, evidence-informed practice in their local areas. So basically, Changemakers is as visible as possible to their senior leaders. In terms of fidelity of the programme to the delivery plan, I think our conclusion is that implementation of EBIs has largely followed kind of what was expected in the delivery plan, which Jolie set out at the beginning. A couple of things I wanted to speak to here. I mentioned already that consistent support from the practice development advisors at Foundations has seemed to be really critical to kind of helping sustain momentum and ensure delivery quality. They've provided kind of structured one-to-one support, and they kind of shared pro forma tools that they've used across all the PDAs, means that across the local areas there's a degree of alignment with programme principles. They've really encouraged kind of reflective practice among the LELs, and monthly kind of project management meetings are spaces where the PDAs can share their experiences of supporting the LELs, and again kind of help to maintain that coherent support approach. And then in terms of the adaptations LELs have been making, we found that all of the LELs have needed to make quite pragmatic, locally driven adaptations with a view to improving the fit of the EBIs within their local context. And again, that reflects the approach within Changemakers of being really flexible, really context responsive. We found that these adaptations are typically kind of negotiating quite small changes, typically with EBI providers. So rather than big changes to the core EBI models, typically it's around language or delivery format or training resource. Sometimes it's in response to a particular challenge that they've encountered when delivering. Sometimes it's about seizing local opportunities. Sometimes it's about refining scope. Adaptation and flexibility have clearly been really necessary for local fit, but I suppose an emerging learning from our side is that LELs may benefit from kind of clearer processes or expectations or guidance and how to kind of maintain confidence that in making those adaptations, you know, there's something here about the EBIs, they're being delivered often in settings that are really different to where the EBIs were originally delivered and tested. And Rob spoke to this earlier, there's been huge value in kind of the questioning and the reflection that the LELs do, but there's something about kind of moving forward, and if this was applied in other local areas as kind of approach, just making sure to support local evaluation skills so that they can be kind of these effective consumers, critical consumers of evidence. Finally, it's too early for us to be able to kind of establish the extent of Changemakers integration within local areas, but I would just say that early evidence suggests that where the LEL role has integrated particularly effectively, it's been where Changemakers aligns with local priorities and transformation agendas. So for instance, inspection frameworks or kind of wider local family support strategies. It helps where the LEL is embedded within existing multi-agency forums. So for instance, family hub boards or groups which are focused on continuous improvement or early help or prevention, them being part of those groups seems to be really helpful. And where there's kind of consistent communication with senior leadership. So LELs presenting regularly about the EBI progress at key management meetings, for instance. I'm going to speak briefly to how the Changemakers programme has operated across different local contexts. And what we're finding is that Changemakers, the model is quite adaptable and that it can work in areas with differing levels of readiness. But we're finding that the progress might be quicker where there are specific kind of contextual factors. So first of all, kind of local system readiness. Is that local system, have there been an EBI delivered in that local system before? Is there infrastructure for an EBI that the LEL can draw on? Or is that local area actually really starting from first principles? As I mentioned before, whether or not the EBI is aligned with existing local strategy. Also, whether there are kind of reform agendas in that local area which are creating tailwinds. So one local area, for instance, really benefited from alignment with ongoing kind of maternity and early years reform, which just meant that actually their EBI was really, really well placed to embed within existing antenatal pathways. Organizational culture, we think, shapes roots around embedding kind of EBIs. So for instance, one area we found had a really kind of strong co-production ethos, and that meant that the delivery model of the EBI, which as I mentioned earlier, involved parent co-delivery, it really supported and facilitated that kind of community-led delivery model. And finally, leadership commitment, unsurprisingly, really informs the sustainability of the programme. LELs, as has been alluded to already, they bring really diverse professional backgrounds and as a result, really unique strengths to the LEL role, supporting varied but equally valid approaches to embedding evidence use. There is no single blueprint for the LEL role, and so much of their effectiveness seems to depend on their alignment with local culture, their knowledge of the structures within their system and the priorities within their local area. And then speaking really briefly to that final question around kind of perceived impacts. What we're seeing is that the LEL role has improved the coordination and the feasibility of EBI implementation. Having a dedicated lead allows teams to manage recruitment and training and data challenges more quickly and efficiently. And although very, very early in development, there are maybe some promising signs that LELs may be in some ways helping EBIs reach more diverse and underserved families. There's certainly evidence of the LEL role enhancing the visibility and perceived relevance of EBIs within local systems. And by embedding EBIs within these established structures, LELs help increase their credibility among senior stakeholders. And in terms of system level shifts that the LEL role helps support, some emerging evidence, we think that the LEL role is beginning to drive system level engagement of evidence. So maybe shifting EBI from being these standalone projects to actually part of a more evidence informed local strategy. We saw evidence of structured reflection and coaching in those learning spaces by LELs, building kind of practitioners' confidence and motivation to use evidence. The partnerships and the networks that LELs have fostered, strengthening local infrastructure for evidence use, though, may benefit from some ongoing support to become kind of self-sustaining beyond the lifetime of the programme. And there's something here about, expectations and accountability, clarifying those to reduce reliance on any one person and enable that long-term culture change within local areas. So to finish up, some brief conclusions. We think that the Changemakers model seems to be broadly achieving its aims. LELs are helping to embed EBIs, strengthen partnerships, and promote more reflective, evidence-informed practice. The LEL role has been pivotal to that, and flexibility to adapt to local context has emerged as a strength and a really essential feature of success. And progress is fastest where the systems are already ready for change. Those early impacts that we're observing seem to be mainly organizational and cultural, around kind of raising the visibility of EBIs, improving and coordination of delivery, increasing confidence to use evidence in decision making. But as I've already alluded to, sustaining those gains will really depend on embedding learning and the relationships and the behaviours into local governance structures and improvement frameworks. What comes next for our evaluation? I alluded to the fact that these are interim findings. There is one more final phase to come. That next phase will consolidate learning from this interim period, but also really test the sustainability and transferability of the model and the LEL approach. I'm not going to go into depth about these four kind of key areas that remain on the slide, but happy to delve into them in the Q&A if that is of interest. We're looking forward to the final phase and some more final findings. Thank you very much.
Thanks, Louise. That was so interesting. And obviously us at YAF are super interested in this project as co-funders, but also beyond that, because I think there's some real sort of learning that we can use for some of our other change programs. And I'm sure foundations are sort of seeing that and thinking that as well. Are there any questions from anyone in the audience? As I said earlier, please put them in the chat or raise your virtual hand. I have a couple, and I'm going to start off with one for you, Rob, if you don't mind. And it might be another area you might want to come in. Near the beginning of your presentation, Rob, you mentioned that even where the role is unlikely to be sustained, specifically after the end of Changemakers, that space will still be maintained for evidence-based decision making. I'm really curious to understand where that is likely to sit, or even if you know that. So I'm thinking, is it sitting in commissioning teams, principal social worker roles? Is there sort of already some early signs as to where that thinking is most likely to sit, and does that vary across areas?
Joe, I don't know whether you want to take that one because you've maybe got a greater oversight across the multiple areas.
I think it depends on the local area and what they want to do as well. So we're just about to start another project called Partner Places, which is building on the learning from change makers. And in this one, the local authorities are going to be implementing a wider range of EBIs or practice guides. So it will depend, I guess, on what it is they want to implement. It's mainly going to focus around the FFP implementation, but it's going to depend on the age range, the level of need, which partners are involved in terms of the implementation. So, for example, in Changemakers, we had a perinatal intervention that was implemented. So we had our Healthy Child Programme staff and midwifery teams involved in the implementation there. But for older children, you probably have a very different group of stakeholders, which may or may not be part and parcel of the local authority. So I think it is context dependent, and which part of the system where the focus on implementation is going to take place. But the common principles in terms of how evidence is used, I mean, that could be anybody who has the set of skills that we've seen exemplified in Rob's presentation, really.
I think that's a good summary, Joe. I think what I'd add to that is this is where a kind of evidence use framework really helps, doesn't it? Because it like this work shouldn't be dependent upon any one individual, although that is helpful. Our roles have been about how do we influence others around us, and the kind of long term for that is how can we articulate that in a way that people can use in a meaningful way in their day-to-day work. Looks like Keith wants to come in though, so
Hi, Gail. Thanks, Rob.
Okay.
Keith Billington. I'm the local evidence lead for Wirral on Merseyside, and we will draw a line under the LEL role at the end of March. I'm moving over to Family Hubs transformation into Best Start in Life Family Hubs. So the take with me most of the learning, or a lot of the learning from this last 18 months into that new role. The role of the LEL, you asked the question, where will it sit? So in Wirral, the post won't exist, but the principal will continue. I've scribbled down a couple of thoughts that I'll share with you now, because I have got to shoot off dead on R3. So the couple of successes, I think. So the embedding evaluation into our continuous improvement journey. Wirral have been on requires improvement for 5 or 6 years now, and we're determined to get to good. And as you know, or as you probably know, in local authority land, requires improvement tends to occupy the minds of social care. But what we've been successful in doing is making sure that has to include discussions and thoughts about early help and prevention. So the principle of evaluation, particularly around EBIs, is embedded in the CI framework that we've got going, and that will be carried on by our performance and improvement team. After I've shuffled off stage left. Another success we've had, part of the challenge the foundation set us was to address the EDI agenda, which is something probably has slipped off our radar in Wirral. Of late, over the last couple of months, we've had huge successes, particularly with one particular organisation called World Change. Getting that organisation, which is an organisation that supports refugees, asylum seekers, and the whole BME community in Wirral, back in touch with a whole range of organisations, both under the local authority umbrella, but also through the wider partnership umbrella, and we've run a couple of really positive events with them, and we run EPEC, with our EBI in Wirral is the Empowering Parents, Empowering Communities project. And we've had great success with that, and looking forward to delivering EPEC from Wirral Change in the new year, probably after March, so a testimony to the continued support for that particular EBI from ourselves as we go into the BSIL agenda. So a couple of successes there, a couple of challenges. But I think both Joe and Rob particularly talked about and our colleague from Nesta talked about the challenge of project versus volume. And as we go into BSIL, we've run a really successful EPEC program, but we've only managed to reach out to small numbers of families. So as we move forward to address the challenges that DfE are going to set us with a stretch target around our GLD, we've got to really balance that, what we've managed to get from those parents who've engaged with us on EPEC versus a much wider reach in our community to foster a near 7% improvement in our GLD. So that's a challenge. Yeah, so they're my two challenges. And lastly, while I'm on the platform, one of the main benefits from being an LEL is the support we've had from our colleagues in foundations, but particularly the support and interesting insights from colleagues in York, Rob, from Adam in Merton, and from Louise and Moira in Stockport. It's been a really good group to get involved in, and we've learnt a heck of a lot. So thanks, everybody.
Oh, thanks, Keith. That's really good to hear. And it really brings it to life, some of those examples. We're actually almost out of time. Louise has dropped a question in the chat, and I'm wondering if you could follow up on that one, Joe. I'm putting you on the spot. That'd be really useful, but I don't think we've actually got time to cover it because we're 1 minute to go. So all there is for me to say is please do fill out our feedback form. We would love to know what you thought of this session today. Yanina has just dropped it into the chat. And hopefully you join me in thanking our presenters. It's been a really, really interesting, fascinating discussion from all of you. And thank you so much for your time today in presenting. And thank you everybody else for attending. We really appreciate it. Have a great rest of afternoon. Bye, everybody.
Thanks, everyone.